WCLN 1170 Radio and Cable Channel 16 are pleased to present We Should Know, hosted by J.W. Simmons, an upbeat, informative look at people, places, and issues facing our community. This education-based analysis of issues will remain positive and informative as we consider closely what we should know.
Welcome back, folks. J.W. Simmons here. The name of the show is We Should Know. We want to thank you for being with us today. We look forward to seeing you each and every week, and hopefully you'll continue to watch us throughout the counties we're serving, both on TV and radio. Today we have in studio with us Kory Hair, who directs the environmental health here in Sampson County. And originally from Bladen County, yes, and know quite a bit about that process in both rural counties. So I thank you for being here. Coming to us virtually today, we have Michael Scott, who is the Director of the Division of Waste Management here in North Carolina with the Department of Environmental Quality. Michael, I want to thank you for taking time in what's got to be a busy schedule to just have a conversation with us today.
Yeah, thank you for the opportunity to be here, and nice to meet you both.
I want to start and kind of give folks a little bit of a background on you, Michael. You are not only director of the Solid Waste Division, but you handle the Superfund, underground storage tanks, as well as administrative functions, everything from budgeting to interaction with the legislature, which just saying that part about the legislature would be overwhelming to most people, but you engage with those folks to make sure that as governance of the state, that they're aware of what's going on. The thing that strikes me is your background academically in agronomy tells me that you have a passion for agriculture, and we share that. We share that also with NC State. That's where my master's background is as well.
Yeah, thank you for that. Yeah, we still have a small family farm in Guilford County, and really enjoy those aspects and working with my dad there, and enjoy, working across the state of North Carolina and the opportunity that it brings to meet so many people and to manage the programs we have at the state level to assist all of us across North Carolina.
And also, I want to kind of include Melody Foote, the PIO for your division there. I want to thank her for helping put this together as well, and a big shout out to her. So let's kind of get into the conversation today. And I mentioned this off air, and I've talked to Kory about it. One of the things I want to get into to start with is this whole thing about forever chemicals. And the PFAS is another phrase. And there's so much information going on. There's a bit of concern, I think, by a lot of folks simply because they're hearing the information. They're hearing from people that's had various horrific kinds of health issues that tend to direct it to these kinds of chemicals. And of course, the website with the state does address it to some degree, but I wanted to give you an opportunity to kind of educate us a bit, and then kind of segue to Kory on a local level to kind of give his perspective, because one of the things I want to do is it's one of those things that you see it from one window on the local level. Where you're at, you see the entire layout. So I'll start with you, and then I'll segue to Kory to get his thoughts.
Well, like I said, we appreciate the opportunity to be with both of you and touch on this important subject. We talk about forever chemicals, that term, or PFAS, per and polyfluoroalkyl substances. What's important to know is they're man-made. They're not naturally occurring, JW, in the environment. There are certain items like heavy metals that we may find in soils naturally. We don't find these chemicals naturally. They're man-made. They're very persistent. They do not break down with sunlight and other environmental factors. They're actually designed to, in a sense, be forever chemicals. In the statewide and nationwide approach that the Environmental Protection Agency has taken, we realize that they can have detrimental health effects, whether that's impacts to immune systems, certain types of cancer, or even increased rates of cholesterol. And so making sure that these chemicals are not able to be directly consumed, or the human body not exposed to them, is key. And our work, as you indicated, is statewide. In the Sampson and Bladen and Cumberland County areas, there is a lot of increased focus related to the Chemours plant there on Highway 87 that was formerly DuPont. And so at the Department of Environmental Quality, as a state agency, we're not only working in Sampson and the surrounding counties related to the Chemours plant, but we are implementing a statewide PFAS strategy. And that touches on protecting communities, making sure they have information. And like I said, we appreciate the opportunity to share information through this outlet this afternoon. Protecting drinking water. That's one of the primary exposure routes of these forever chemicals. The way they make it into the human body is primarily through consuming them through private wells or other surface water features. And when we find them, make sure we're taking the effort to clean up these compounds that may be in the environment so they don't present future exposure risk.
I think it's critically important. I want to segue to Kory. Kory, is this something, I know your department deals with water testing and those kinds of things. Is this something that concerns you, the ability to be able to test for that on a regular basis? And is it something that is happening with the local water treatment facilities here to monitor that?
When we first started this conversation about coming on the show, I did a little research because this is something new to environmental health. Unfortunately, when we take water samples in Sampson, Blade, and places like that, we send all our samples to the state lab. And to test for PFAS, you have to have a special lab to be able to test for those chemicals. And as my knowledge right now, the state is not set up to be able to test for those chemicals. So as of right now, we are not able to take samples and send them off. So I know there's a list of companies, like I think there's two in Wilmington and one or two others in the state that test for PFAS, Gen X, things like that. So I see it as an issue down the road because being from Bladen County, I'm fairly close to the Chemours plant. So this sort of has concerned me since 1819, since it really became an issue. So I see it as an issue down the road, but whether the county is going to be able to sample for it, like we do the others, water samples, I don't know. It just depends on how far the state decides to go with their lab.
So back to you, Michael, as we're talking about this testing process, it sounds as though it's not a simple process. So it seems to me there's a huge cost to this. Where does that weight come from? And is the Chemours plan, are they looking at utilizing their financial resources? Because as you know, the legislature is doing best it can right now to even pass a budget.
Right. Yeah, appreciate the question. It's a very important topic. What we want folks in Sampson County and the surrounding counties to know is through a consent order, a legal document that was reached in Bladen County Superior Court, Chemours is required to pay for private well testing. That includes currently parts of Sampson County, Bladen County, Cumberland, and Robeson. To your question, JW, it's not a cheap private well test. It can be about $300 if you try to take a sample yourself and send it to a lab. Under this legal document, Chemours is required to have their contractors pay for this testing. And that testing has expanded a good ways from the plant. We're out beyond 20 miles from where they're located in Bladen County. Most of that's related to these forever chemicals, or what we call PFAS. And one of the PFAS is Gen X. People may be familiar with that name in the media. It has spread through atmospheric deposition, meaning rainfall or just coming down as dry material up to 20 miles from the plant based on prevailing winds. And prevailing winds are in that northeastern direction towards parts of Sampson County. So in summary, there is the opportunity for residents to request this free well sampling. Chemours will send their contractor to sample the well, receive the test results, and then notify the homeowner if these compounds are present. If they are present at levels in that legal document, we call it the consent order, the homeowner may be eligible for filtration or connection to municipal water if it's available.
It brings on the other question, or actually two questions to Kory. As we look at municipal water here in this county, and I'm sure in parts of Bladen as well, does the counties individually look at PFAS in their system when they're testing for lead and other things, or do they have a fund set up separate for that?
The water here in Sampson, is regulated by the Public Works. My knowledge is that the public water supply is not tested for PFAS as it is right now, and definitely they don't have the treatment systems to remove it if it's there. Mm-hmm. But I know just reading some of the documents that DEQ and stuff has put out, that is on their radar partly of what they have in place to get done in the future as far as all the public water supplies and everything to be tested for PFAS.
Is this, for a local county, is this a heavy weight or additional manpower or personnel power that you have to if this thing goes into gear and folks start really requesting this, is this something that's going to require you to have additional personnel?
I'm not sure. Like I said, that's a different department. That would be the Public Works Department that handles the public water supply. But just for what I see is it would be a reverse osmosis system to remove the PFAS. Now, how large a scale it would be on for a public water supply to be able to remove from like the water storage tanks we have in the Sampson, I'm not sure. But possibly, yes, I would see the need for additional employees to be able to handle it.
We're going to continue this conversation, and we'll take a quick break and we'll come right back. But Michael, I want to kind of explore the idea of how far that particular court order covers. Does it just cover for the sampling and testing? I also want to maybe address how the connectivity flows for folks that are watching this show. Is there a contact number that we can put on the screen, a website, or something of that nature? So I want to discuss the process when we come back. Ladies and gentlemen, stay tuned. We're talking about a key issue that may or may not be affecting your life, but you need to be informed about it. And we got the folks with us to talk about it, and that's safe drinking water.
Providing fewer commutes, more backyard offices, and crystal clear meetings. Providing less, you froze up, and more presence in your presentations. Providing a better internet experience. Providing possible.
You're out for an evening on the town. Finally a chance to relax and forget that you left your front door completely unlocked. Fortunately, you just installed a security system from Star Communications. With just your cell phone, you can check on your house, lock it down, light it up, and get back to relaxing.
He forgot to put Buster in his crate.
Unfortunately, we can't help with that. Security and automation from Star Communications. Call today to find out more.
Most aging adults want to stay in their homes as long as possible. And as your loved ones get older, you want to support them, even when you can't be there. Star is proud to offer Star Alert. This new system is now mobile and has GPS compatibility, so your loved ones can live their lives and you can have peace of mind, knowing they can get the help they need with just the simple push of a button. The new Star Alert also offers automatic fall detection, so help will be alerted even if they can't press the button. Call and ask about Star Alert today.
Welcome back, folks. We're talking about health issues. We're talking about waste products. We're talking primarily about something called PFAS. And we're talking with Kory Hair, the local person here with the health department, environmental issues. Kory, you're the contact person, should I say, the head of the spear on that. And we've got a person on the phone here that literally understands the dynamic of that, and that's Michael Scott, who is the state director for waste management and various other things happening in the state. The whole terminology with PFAS, Michael, I want to start this second segment with you, is that you so easily pronounced that word polyfluoroalkyline a while ago. It has so many titles and so many names, plus I understand that when you look at one of the particular products, if you will, that is in that kind of Gen X world, that it depends on how those molecules are twisted. and it may be another name, and if the court order applies to one, it may not necessarily apply to the other.
Yeah, that's a great point. When we talk about PFAS, or per and polyfluoroalkyl substances, it's a family of compounds. There's thousands of them, meaning a lot. The court order that we touched on a little earlier today specifically addresses 12 of these PFAS compounds that are unique to the Chemours Company in Bladen County. One of the 12, a lot of folks may have heard of, is Gen X. There are 11 other PFAS in that court order that are basically, or consent orders, what we refer to it as, that are basically a signature of these compounds that have originated from that plant in Bladen County, meaning Chemours. There are other PFAS across North Carolina. You hear a lot about PFOA, PFOS. There's other sources, not just chemical manufacturing, but even firefighting foam deployment, other industries where these compounds have historically been utilized. But yeah, the specific consent order identifies 12 of that PFAS family that are specific to the work surrounding that plant.
And for further clarification too, from what I can understand, this whole product, as we talk about it, can be found from everything from raincoats to cookware.
That's an excellent point. These compounds are found, beyond just the site of chemical manufacturing, meaning where they're created. They can be in everything from nonstick cookware, Teflon, to fast food wrappers, pizza boxes, oil resistant, stain resistant items. They are designed, as we said earlier, to be forever chemicals, to not break down easily, and to really sustain themselves in harsh environments. So it's not just limited to areas of chemical manufacturing. It can be in regular products that as consumers we utilize. One of the important differences is, though, these other products are not necessarily items we directly ingest, meaning you drink water directly from a private well or directly from a municipal source that may come from the Cape Fear River. That's very different than interacting with a product that may have PFAS, but you're not putting it directly into your body. Yeah.
One of the things, and you and Kory both, I'd love to get both of your commentary on this. It seems that we're looking at this particular issue, and when we do, one part of it says we can localize it to a certain distance from certain places, like manufacturer, that kind of thing, where Chemours is actually manufacturing it. It may be 20 miles out, as you pointed out, Michael. But the other part of it is, it seems like this has been going on so long, since 1940, I understand, that it's now kind of permeated every part of our environment. Is that what you're sensing, Kory?
That's what I when I did the research on it, looking at it, it's been around since the late 40s, early 50s, in everything. Plastic bottles, and even in the clothes that we wear. And that's talking about ingesting, drinking is main way, but also I've done some research and looked and sort of concerned, like the pants I have on are stain resistant. Mm-hmm. So they may have one of those chemicals in it, not sure. But just to think about it, when you sweat, your body takes stuff back in. So could this stuff be permeating through our body, our skin into our body, and getting it that way too? But so yeah, I mean, it's a very concerning issue.
So Michael, address that if you could from where you see it. Is this product, is this chemical that we're talking about pretty much permeated throughout our society already?
Yeah, there are definitely worldwide data, JW, showing the presence of these compounds, as Kory related and touched on, back to the 40s and 50s. They've been used quite a long time. They've been discovered in the far ends of the world, if you will, and they're prevalent. In some areas, they're more concentrated than others. Like we're talking today, Sampson County, Bladen, Cumberland, Robeson, we are seeing higher levels of these PFAS compounds because of what was emitted from ultimately the Chemours, formerly DuPont plant there on Highway 87. But it's not to say you won't find these compounds, let's say, in parts of North Carolina, even areas near the mountains where they've also been detected. We may not know the actual source. Is it firefighting foam? Is it another type of manufacturing like electroplating or a stain-resistant type manufacturing? But yes, they are common, throughout the world. They're being found, unfortunately, but they are definitely more concentrated in certain areas as we talk about Sampson, Bladen, and other counties today.
Would you speak also, Michael, to the impact? I was informed that the ag folks with NC State and other entities is looking at this from the impact of agriculture. And I know you've got a background in agriculture, academically and otherwise. Is that something that concerns you, particularly as consumables is happening in ag? Is that something we should become even more aggressively dialed into? Just kind of educate us on that part.
Absolutely. As we've discussed a little this afternoon, one of the primary areas is direct exposure through drinking, like private well water or another contaminated water source. That's one of the most important areas where people are most directly exposed. And a lot of this information comes from a valued partner, the State Department of Health and Human Services, and their collaboration with the health directors in each county across North Carolina. What we are seeing, though, is there are other sources of exposure. North Carolina has a PFAS collaboratory that's a group of universities, NC State, East Carolina, UNC Wilmington, that are also working on this important subject of PFAS. And they are doing some direct research on the presence of these compounds in agricultural products, a lot of different fruit and vegetable production, and are those potential routes of exposure. There's also been some initial work by the FDA, Food and Drug Administration, on this important front. If the compounds are present in soil, can an agriculture or backyard garden, if you will, take up these compounds and then they're present in the fruit? So there's not a message to not consume vegetables and fruit. They have a lot of health benefits, as we all know, but it is important to note there's a lot of ongoing research looking at these other ways PFAS may make it in to the human body.
Kory, do you get a sense from the folks you talk to kind of on the grassroots level that they are concerned about this, that is something that the counties are going to have to really engage in going forward? Because it seems that the publicity angle has been out there for some time, but it is taking on, over the past few weeks, I've noticed it taking on new momentum.
It's going to be tough for the counties to really jump out there and, I feel, do anything, because we're sort of bound and limited by what the state allows us to do, because we in environmental health enforce the statutes of the state. And so if the county goes above and beyond enforcing what that is, then the county has to sort of stand behind that on their own without, the Attorney General backs us now. So it's going to be sort of, I guess, county to county figure out what they want to do, because if the county takes on anything above and beyond what the state regulates, then it's going to be this county that has to front the cost and pay for what that in turn costs. Like if they decide to do water samples for PFAS and the state isn't able to run them, then we would have to find a lab and cover that cost ourselves.
Michael, do we have the facilities available if there is a demand for ramped up testing? Is facilities available? Is the capacity available to handle a huge increase in test requirements?
Yeah, that's a great question. We're seeing more and more testing for PFAS. Our division within the Department of Environmental Quality is now requiring all of our landfills to test. The sanitary landfills, meaning where your household garbage goes, your construction debris goes, those are having to test for PFAS. So to your point, more and more of these samples are being taken, and we are seeing some of the laboratory testing times be extended, meaning it's taking another week or two to get results because so many people are now running these tests. We are hearing that there's, discussions on broader state testing. DEQ has initiated its own testing of some of the drinking water supplies, meaning municipal water. There's the work I briefly mentioned by the North Carolina universities on this PFAS subject, but there is a good network of labs that can run these samples. But to your point, they are facing increasing requests for more and more samples to be analyzed as we look at more facilities, more sources, and a lot of people are interested in, what does that data look like and what do we do to eliminate any exposure to these compounds?
Absolutely. And I want to kind of go to a break, and as we come back, kind of explore this a little bit more in depth to try to get an understanding to the folks that what we're talking about and how it might impact their life. Ladies and gentlemen, we'll be back in a moment. Call a friend and stay tuned. We're talking about something that affects your life and your health. We're back in a moment.
Eastern North Carolina is a beautiful place where we gladly choose to call home. And we strive to provide the best communications services. STAR is committed to improving communications to all our service areas because we want to improve the communities where we not only work, but also live. STAR Communications. We are neighbors serving neighbors.
To get customers, you need exposure. Let our team of experts craft and produce the perfect video ad to reach your intended audience while making the most of your advertising dollars. Call 1-800-706-6538 or visit starcom.net to contact our STAR Communications production team and get your business moving to the next level.
105.7. 105.7. Tuning into Christian 105.7 is tuning in to a space of hope, encouragement, answers, and love. With the magic of radio or the convenience of the internet, Christian 105.7 is focused on sharing the universal truth and light of Christ with a local touch that creates that special feeling of community. More than just another broadcast station, we're your neighbors. Christian 105.7. What faith sounds like.
Welcome back. We Should Know is on there. J.W. Simmons here, your host. Our guest today is Michael Scott, the State Director with DEQ. That's Department of Environmental Quality. And we hope it remains quality, Michael. Thank you for being here. Also, we have with us locally Kory Hair, who is with the local health department in Sampson County, originally from Bladen County. We're talking about PFAS. We're talking about something that's impacting folks' lives. In the first couple of segments, we went into some detail. Now I want to try to steer folks into an area they can find more information on off air, on break. Kory, you were mentioning that you were not really set right now locally from a local level to be able to deal with what could be a huge influx of requests.
That's right. As of right now, we don't have the capacity to pull samples and send them off and get them tested. But what we do in a situation like this is we would create a informational packet if needed to, when people call, direct them where to go, websites, phone numbers, people to ask and call and talk to the experts that know more about it than we do at this point, and also to a list of labs if they wanted their water sample tested.
So Michael, can you kind of address that a little bit? I guess what I'm looking for is the plan, and I know there is one, the plan as to how to steer people to those particular testing information pieces and help them understand why there might be areas that is not covered under that lawsuit, even though they think it should be.
Right. Yeah. Thank you for the question. There's several great resources. We work at the state level, Department of Environmental Quality, DEQ. Folks can do a quick search of DEQ, PFAS, PFAS. They'll find a lot of information specifically regarding Chemours and the ongoing work to include work in Sampson County with private well testing. That's one of the most important messages for folks to be aware. that these forever or PFAS chemicals can be present, unfortunately, in their community. And one of the best things they can do is seek private well testing, especially if they're in an area where that testing is ongoing, meaning we've already found these compounds in that area. Some of the current work is about 20 miles from the Chemours plant on Highway 87, up near the greater community of Stedman. And so those particular parts of Sampson County would be a good area if you live in it and you drink from a private well, not municipal water, but you drink from a private well on your property, to call a number we have. It's 910-678-1101 is a number for Chemours to request private well testing. And also look at our website for a wealth of information and our state partner, Department of Health and Human Services. They can speak to community members about potential health effects. They have also put together, JW, a physician's memo on PFAS. So folks that are concerned about potentially being exposed to these compounds can take this document to their family physician, and it provides that physician with some background on these compounds, potential health effects, and follow-ups that may need to be considered.
I think that's exactly what we need, Kory, especially on the local level, is that ability to say, here's where you go, here's how you get the information. And Michael laid that out perfect. Do you think that's going to be adequate for folks that may be knocking on your door?
I think for the most part, yeah, it gives them a direction to go to start with. And then once if they do have an issue, then it might become, a little more to it. But I think to start with, to be able to give them somebody to talk to that knows about it, a website or something that explains things to them, I think that will be sufficient right now until they're able to find out what the health effects really are of this, what is the contamination level that causes a problem. So yeah, I think that would work. And that's where I got a lot of my information before coming here, is just reading up on it and from DEQ's website and other, just Googling PFAS.
Yeah. Michael, you mentioned something that I think deserves a little more attention, is the idea of the medical community, i.e. the doctors and the folks that look at the physicality of people as a whole, their patients. Are the doctors in the medical community aware of, obviously they're aware of what we're talking about, but are they aware and dialed in that, there may be this large influx of folks coming in saying, look, I want to get tested for something called PFAS, and I'm sure they're going to be aware of it, but how do we educate, and I say that we collectively, is what I do, and of course what Kory does, on a local level to make sure our hospitals and our doctors understand how critically important this is?
I think the message on PFAS is definitely, getting out there. I think this effort by Department of Health and Human Services, they're the lead on the health side. I think this is the starting point with what we refer to as the physician's memo, to provide some background on PFAS, what they are, potential health effects, and then what needs to be discussed with a family physician as far as other screening tests at the medical level. What are resources at the state level? There's a lot of risk assessors and other talented folks at Department of Health and Human Services who are answering a lot of the questions regarding health impacts. Are there exposures to skin or eating fruits and vegetables that may have these compounds? They're fielding a lot of those difficult questions and making sure that information makes its way out into the medical community. As I also noted, there's a lot of great work underway by North Carolina's university system. So some of those folks, Dr. Jane Hoppin from NC State, a lot of folks out of East Carolina, Dr. DeWitt, folks are looking at the actual health impacts. They're actually providing testing of some community members in their different research studies to quantify, even within the human body, what the levels are of these forever chemicals.
Michael, is this a learning process as well for companies like DuPont, Chemours, and these companies that create these chemicals to address maybe the long-term effects along with the development of the particular chemical before it actually goes out? Did we, in essence, as said many times in rural areas, sometimes the cart gets before the horse?
Right. Yeah, that's a great question. There's a lot of ongoing work looking at the toxicity of these compounds. We know a lot about some of them, but there's thousands, as we mentioned in the other segment. So there's information on Gen X, which comes from the Chemours plant, PFOA, PFOS, which can come from a variety of sources across the world, but other PFAS, there's not much information at all, how it impacts the human body, what the broader effects are environmentally. And so there's a lot more to do on this front. There have been numerous conversations on, how do we produce a new compound as a society, yet we may not know all the impacts of it environmentally or health-wise. So there's a lot of discussions within our country, comparisons to what goes on in Europe as far as chemical production and how we navigate this in the future.
Kory, when you look at the local impact, and again, I think it comes down to this kind of ground level where people are interacting and talking in churches or civic meetings or, wherever they go, the conversation gets hyped up. And if we don't get a full story on like what we're doing today, sometimes they get lost in the noise and it creates chaos. And that's something I'm hoping I'm doing here to not create that chaos.
I think getting the information out of where it stands now, what the companies are doing, what Diener's doing, DHHS is doing to try to head this off. I mean, yes, it's been going on since the 50s. But now it's come apparent, and it's not like the different entities are just sitting back seeing what's going to happen. They're trying to head this off and change it in the better direction, to send it the opposite way and stop what's causing the problem, figure out at what level they're causing the problem, but mostly trying to get the information out there so the people will know. And the same thing with us. I mean, if they call us, we're going to do our best to inform them of what we know. Mm-hmm. And then also, like I said before, point them to those that are more informed than we are.
Michael, in your position, and I look at Department of Environmental Quality, and as director of that section there, is there things that you want to say to folks that they could actually be of help in the not only the solution, but I guess their survival through this process?
Absolutely. I think the commitment here is to be a resource and provide all information we can to keep community members informed. We want them to be aware of the potential presence of these forever chemicals, to understand they can have health effects, but there are ways to address that and prevent that. And so, we're a resource here to provide it. If it's impacts related to the Chemours plant in Bladen County, there may be solutions that are completely paid for, whether it's household filters or connection to municipal water, initially providing bottled water. All of that's covered, meaning the complete cost. If it's an impact that we can't determine is related to that particular plant, there are other solutions. We do have statewide funding now to help with filtration systems if a private well is impacted and it's not related to Chemours, meaning those 12 compounds we talked about, JW. We have some state funding to help community members pay to get a filter on their private well. And so there are some more state solutions now, a lot more health information coming out on this front. But we also interact with folks that are new to a community. They may have moved in or come from one county in North Carolina to another. They're not aware of this issue. And we just want to make sure everybody has the information to make an informed decision for their family, meaning what water they're consuming, does it need to be tested, and making sure if there's any exposure risk there, they also have the information to speak with their family physician.
We're going to take a quick break and come back and try to tie this up, gentlemen. Stay with us. Stay tuned, ladies and gentlemen. We'll be back in a moment. We're talking about water safety and your health.
For the ultimate Wi-Fi experience, You need whole home Wi-Fi from Star Communications. Star's whole home Wi-Fi provides ultimate coverage, ultimate performance, and ultimate power all the time. Star's whole home Wi-Fi systems feature the latest Wi-Fi 6 technology and are equipped with unrivaled bandwidth and 4 times more simultaneous connections. So you can connect tons of devices throughout your home with no lag and no downtime. Plus, with 24/7 support and remote troubleshooting, you can rest assured that Star is always there to help you should any issues arise. Star's whole home Wi-Fi also comes with the Command IQ mobile app, putting you in control of your home network and making it easy to set up and connect devices, run network speed tests, pause Wi-Fi, and set parental controls all from the palm of your hand. It's the ultimate Wi-Fi experience. Contact Star today to get started.
Just because something may work doesn't mean it's right for your business. Let Star Communications' knowledgeable consultants help you customize a hosted voice system that's right for you. Our dedicated experts work with you to understand your business needs and guide you at every step, from choosing and installing services to ongoing maintenance and support. Contact Star today.
Honey, do we pay our bill?
What bill?
The Star Communications bill.
No worries, honey. With Star's paperless billing and automatic draft system, I get a notification sent right to my phone. There's no need to be bothered with those paper statements, and our bill is paid on time every month.
Well, that's easy and convenient.
It sure is, honey.
Honey?
Yes, dear.
The baby.
Oh, right.
Welcome back. Star Communications Channel 16, WCLN Radio. It's called We Should Know. I'm J.W. Simmons, your host. Thank you for being with us. We're coming up on our last segment. We're talking with Michael Scott, who is the State Director for the Department of Environmental Quality, and also our local guy here with the Health Department, Kory Hair. Originally comes from Bladen County, but he's with us today to help kind of give us a perspective from, as you can tell, 2 huge different ends of the spectrum on PFAS. Michael, I'm going to go to you on this segment with PFAS, trying to tie this thing up. And of course, we're going to try to put some numbers on the screen for folks so they don't have to remember the websites. We'll try to put that up for them on the screen. But the other thing that strikes me, and you alluded to it off break a while ago, was this idea of the Cape Fear River, which is something that goes right through Wilmington, and people are out there with fishing poles, others that fish just off the coast where the Cape Fear River goes out into the ocean. There's been a huge amount of concern of the quality of the seafood. Tell us what's going on with that, and is there going to be a time that we can say, well, it's okay again to eat those fish?
Right. Great question. Appreciate the opportunity to touch on that today. The Department of Health and Human Services, our sister state agency, in coordination with Department of Environmental Quality, who I work for, have put forth, it's a DHHS fish tissue advisory. This is something that has been requested, JW, over the past few years from community members, Bladen, Sampson, Robeson, Cumberland counties, who've got to know this PFAS subject, understanding that it can impact private well water. It can also potentially impact municipal water, as we're finding out across North Carolina. But they've asked about, what about venison? What about wild turkey? Or initially, what about the river, the Cape Fear, and a lot of the fish species that people enjoy fishing for and obviously catching and taking home. So I do encourage community members, look for information to the local health department, State Department of Health and Human Services, reach out to us at DEQ. There is now a fish tissue advisory for the middle and lower Cape Fear. It covers areas just above the Comores plant on down towards Wilmington, as you referenced, JW. It covers a series of fish species for women who are pregnant, nursing mothers, and children. There are certain fish species, red ear sunfish, some of the largemouth bass and catfish species, that it's recommended not to consume those based on the presence of these PFAS compounds. DHHS, DEQ collectively sampled a large number of fish species throughout the Cape Fear River and found the presence of these forever chemicals. And based on that presence in fish tissue, it is recommended that certain parts of the population, pregnant women, nursing mothers, children, not consume those. And so it's important information. It's very recent information. The lead state agency is Department of Health and Human Services. We're in Bladen County the other night at the community college with them, hosting a community meeting on this important subject. They were in Brunswick County earlier this week and having a virtual meeting actually tonight on this important subject. But it's something communities have been concerned about, not just private well water, but where else could these forever chemicals be present? Absolutely.
Kory, just listening to Michael, it strikes me to just simply say it sounds like DEQ is on top of this and pushing everything they can to inform people. From where you sit with the county, is there something else that should be going on that maybe we're missing?
The only thing I can see, and Michael touched on a little bit with the question I had, is I know Comores plant, a lot of it was come out of the stacks and settled like he touched on before. And I know in my understand they've put scrubbers on that to try to combat that. But how much does it affect the produce? You know, Sampson County is a large produce county. Mm-hmm. And does the water, if say they water out of the ground these center pivots, mm-hmm. is the water contaminated with PFAS, and does that get into in the vegetable itself, the fruit or whatever? But that, I think, just reading the information, that is part of the studies that are going on to try to figure that out. Because definitely the fish would be a easier target for it to get into because they released the chemical into the river. So just that in the future to figure out how far the PFAS has affected in nature.
That's a good point, Michael. And I kind of add to that, this idea that if it's in the water and somebody bathes or has a shower or whatever daily, is that something they should not be doing? Does it only affect you if you intake it internally?
Yeah, that's a great question. And I'll start with just real quick. You know, we work collectively to really turn off the spigot, especially at the Comores plant. Like Kory said, to stop those stack emissions, there's a 6,000-foot barrier wall along the Cape Fear River now to prevent groundwater from going into the Cape Fear that has these compounds. So we really worked the past few years to stop these compounds from making it into the environment. But they are still present in the Cape Fear River. They can be present in surface waters, meaning ponds, lakes, around that area. DHHS has said repeatedly, JW, drinking it, consuming it, private well or municipal water supply that has these forever chemicals is your main exposure. There's not the discouragement to not, shower or bathe if these compounds are present, but that dermal or skin exposure is an area that's being more thoroughly investigated. If you wanted to address that, you would have to filter the well water from the groundwater source, meaning when it comes out of the ground, filter it at that point before it goes into the house. So there are ways to address that, but in summary, the skin or dermal exposure is not considered the primary route or risk, but more research is ongoing as DHHS looks at that closer, and nationwide, people look at that skin exposure closer.
Yeah, there's a lot of things we could talk about, particularly related to this subject. Is there a need, or should Comores step up and be more public and be more involved in what we're doing here today in this multi-county community discussion? I'm told that a lot of their folks are not as open as you are to try to explain to folks what's happening.
Yeah, we know that, a lot of folks work at the plant there in Bladen County, and obviously they're a big employer in the county. And it's a huge chemical plant that's been there for decades, honestly. And so we do encourage, how they share information via their website or share information on particular changes or what their plans are at the site. We have encouraged them as a company to make sure, they're outward facing, being communicative to the public. I know they've had some meetings, JW, with community members. Those have been a little while back. I don't know that they've had any recent meetings with community members as a company, but we continue to encourage that with them.
I think it's a great idea. And Kory, I know one of the things we've talked about that from a local perspective, and I want to kind of segue to this, is this idea of the continued increase of solid waste, particularly in this area. And also, I think, Michael, statewide, I can't see the window you look out of every day, but it just seems to be that's a ever multiplying huge volume of stuff that has to be dealt with on a regular and daily basis. How do you see that, and are we keeping up with the volume effectively in the state of North Carolina?
Yeah, great question. And there's a lot of great staff in our solid waste program, JW, that work on this every day. They permit North Carolina's landfills, inspect those landfills, make sure they're following the appropriate requirements. But we are a growing state, and a lot of people are looking to live and come to North Carolina. Our population is growing. That's a good thing. New businesses are coming to our state. But to your point, that leads to increased waste generation. We're generating over a ton per waste for every person in North Carolina. We have just over 40 facilities like the landfill in Sampson County that manage this municipal waste. We call it MSW, municipal solid waste. These facilities are difficult to permit. They're difficult to site, meaning finding a location that's suitable for them. And so we really have to work hard to preserve that remaining landfill capacity across North Carolina, looking at recycling, looking at materials like food waste that could be diverted to other management means. But it's very important to keep the waste out of the streets, off the roadsides, so people can live a great life and enjoy our state.
Now, I want to kind of, as we're going to be coming to close here in a few minutes, I want to get this in. And my question, I want to start with Kory and then go to you, Michael. Kory, from the local level, as a person that directs what you do here, this environmental health issue, what is the thing that you look at in the next 2 to 5 years when you look down the road? What is the biggest challenge you see in doing what you do and making sure that the public is safe?
Well, I've been here not quite 2.5 years working in Sampson, and just the growth that Sampson has had over the last 2.5, 3 years, just amazing. And just Michael touched on is that's going to create a large increase in solid waste, increased need for potable, safe drinking water, and then just that is the biggest thing that I see is just those two elements to make sure that we can keep up in the county to be able to facilitate the number of people who are coming to Sampson to live. And the landfill itself, the old landfill that's out there was run by Sampson, which we still required to do the water samples. And we have to do the water samples starting now for the PFAS. But companies like GFL and the others around that run landfills, I think they do a wonderful job at handling the solid waste that is produced. And Michael's group, I think they do a wonderful job making sure they're doing what they're supposed to. And the advancements that have come over the last 20, 30 years with the liners and everything, the way they do landfills, I think is helping to keep those forever chemicals from getting in our drinking water and in our environment.
Michael, I want to segue to you. We got about 60 seconds. What do you see down the road when you're sitting there and you're doing all the things you do? What concerns you? What's the thing in the next 2 or 3 years you think we need to all kind of focus on?
Yeah, It's a great question, JW. You know, I think obviously as a growing state, we've got to make sure we're looking for ways to recycle different waste streams that don't need to go for final disposal. We've got to keep a close eye on our state's landfill capacity to make sure we have the adequate facilities to continue to manage the increased generation of waste that our state will face. And we've got to make sure we have the appropriate resources to address things like PFAS. And we've got new waste streams or particular streams that can be recycled, like solar panels, JW. We're going to be working on that in the 2030 decade. Some of these facilities are going to need to be decommissioned, refurbished, or taken down. And what are we going to do with waste streams like solar panels? We're hoping we can recycle them, but some may have to go to North Carolina landfills. And that's not a waste stream or material that we've historically had to manage.
Absolutely, and I think you just hit on a whole nother subject that we could all probably address going forward is the residual impacts of transitioning from carbon, and certainly the solar panels is just a small fragment of that. When we look at that, I think of course you interact with the legislature, and we have some of those folks on the show occasionally, and I think they get that, they understand that, and it's a process that has to be addressed now versus, 2 weeks out or 2 months out or 6 months out. So at least it should be encouraging to folks this show today that folks have their eyes on what's going on both locally and on the state level.
Absolutely. Thank you.
Yeah, I want to thank both of you for being here. We look forward to maybe again in the future. If something comes up and we can help message and keep folks informed, that's literally what this show does. It's an information, education show. We feel like the more people understand and know what's happening, the less problems we're going to have in making sure they are safe and have what they need to survive. So thank you, Michael. Thank you, Kory, and we appreciate very much what you do. Ladies and gentlemen, thank you for being with us today. We look forward to seeing you again next week right here. Call a friend for next week. We'll have another show for you, and may God bless.
Thank you for tuning in to this week's episode of We Should Know with host J.W. Simmons. If you have a question, comment, or suggestion regarding this or any episode, please send your emails to weshouldknowedu@gmail.com. And remember to tune in every Tuesday at 2:30 for another informative episode of We Should Know.